A key aspect of the paper is analysis of the process by which the regulator approves the use of test kits under the Medical Devices Regulations 2002. During the pandemic, a supplier had to make an application for approval to put the test into service. However, suppliers who received early direct awards were able to obtain an exemption. The paper has identified some general issues in respect of regulatory approvals. For example, the basis for granting an exemption wasn't always clear. Exemptions were intended to be temporary, and yet some have lasted for many months or years. There is no specific indication that exemption led to favourable treatment of some suppliers. However, a lack of transparency around exemption generally created this perception. Further, as the government's programme of mass public testing came to an end, the question arose as to how to regulate test kits offered for private use, for example for businesses and within homes. Before COVID-19, suppliers could simply self-certify that their products met certain standards. This created a risk that in producing tests for COVID-19, suppliers might make inaccurate claims about test performance which couldn't be verified and which posed a risk to public health. So, in 2021, the government introduced new coronavirus test device approvals regulations to impose additional regulatory approvals on suppliers. While the government proposed this legislation as an effective and efficient approval system, the paper has identified a number of issues, including insufficient resourcing and significant delays in processing applications. More fundamentally, it has been questioned whether it was necessary to go as far as introducing an entirely new regulatory framework to cover approvals during the pandemic.